As a healthcare provider in the community sector, you are often directly involved with caregivers on a daily basis. Even if you're not in a frontline role, understanding caregivers will help you gain a deeper understanding of what they do and why it matters. Caregivers are a crucial part of the healthcare system. In Canada, the value of the services they provide would be worth over $110 billion if they had to be replaced with paid care. Our healthcare system would collapse without the work of caregivers. As a community healthcare provider, your services help make sure caregivers are supported, and by better supporting them in the community, you can help with achieving the following benefits: prevent the caregiver from burning out and becoming a patient, decrease hospital admissions by helping look after the care recipient, help reduce health system costs, prevent or delay the use of a long-term care bed, and help caregivers recognize themselves as caregivers early in their journey. Approximately 29% of the population of Ontario, or just over 3 million people, are providing care for someone. That might be a spouse, family member, or friend. The care provided can be, but is not limited to, assistance accessing healthcare services, cooking, transportation, managing medications, or helping around the home. A caregiver may provide support for a family member or friend. Caregivers can be young or old. Young caregivers might look after a parent or sibling. A parent might be providing care for a child, and husbands or wives care for their spouse.
I'm a caregiver. Looking after someone can be very difficult and often leaves little time for other activities. We can feel isolated and overwhelmed and need to get extra support when friends and family aren't available. Being a caregiver can also be rewarding and fulfilling, but there are times when we need to ask for help, only we don't know who to ask or what services are available.
Caregivers can struggle with the burden of caregiving. If the care recipient has a complex healthcare condition and needs a lot of support, it can be more than 80 hours a week of care. They take pride in looking after someone, but they can be tired and need help and don't know who to ask. By working at a community provider in the healthcare system, you will often be in contact with caregivers. You'll see them in their homes and at community activities, or perhaps offering transportation or respite services. You can help them find services that can make a tremendous difference in their lives. It doesn't take a lot of time, just handing them a brochure or card with information they can use to research supports that are right for them. These tips, designed by caregivers and providers, support helpful conversations. Healthcare providers who have used the toolkit have shared that using these tips hasn't added more work to their day. Instead, they believe it's made their practice more meaningful. 1. Ask caregivers how they're doing. We ask how the patient is doing, but few people ask how the caregiver is doing, which can contribute to feelings of isolation. This simple question alone can make a difference. Sometimes it's best to talk to them when the person they're caring for is not present. 2. Identify caregivers and include them as part of the healthcare team. They may have valuable information about your client that affects your care planning. 3. Tell caregivers what the plan is and what they can expect next. Knowing about schedule changes or staffing updates helps to relieve anxiety about the unknown. 4. Encourage caregivers to accept help. Caregivers find it hard to ask for help and feel they should be able to manage on their own. Caregivers who don't seek or accept support can be at risk of burning out. This means they and the person they care for will wind up needing additional services. 5. Help connect them to resources. The Time to Talk pamphlet and the website caregivershuronperth.ca have contact information for local programs and services. 6. Encourage them to talk to someone if they're feeling overwhelmed. It's not easy for caregivers to share. Confiding in one person is a first step and can help relieve anxiety and feelings of isolation. If they want to talk to someone, urgent support and crisis support is available by telephone. 7. Revisit this conversation as appropriate. It may take time for caregivers to seek or accept help, and their needs can change over time.
Working with other caregivers has helped me learn that I'm not alone. There are many of us out there, and each one has different needs. As caregivers, we shouldn't feel that we can't ask for a break or not be able to ask for help. Community service providers can play a crucial role in helping us on our journey by learning more about us and partnering with us and helping us find supports when we need them.